We've been covering the Obamacare disaster for weeks, and tonight the dam has finally broken. The Government Accountability Office just exposed what we've been telling you all along. They created fake identities to test the system, fake names, fake social security numbers, fake everything, and 90% of those fraudulent applications were approved for taxpayer-funded health care. But that's not even the worst part. Speaker Mike Johnson just revealed that $94 million in Obamacare subsidies were sent to dead people. This is not a broken system. This is a crime scene. Now let's talk about what's at stake for every American that's watching right now. Senator Ron Johnson exposed the real agenda behind Obamacare, massive consolidation designed to crush competition and funnel money to insurance giants. Representative Brandon Gill revealed that premiums have doubled in just 4 years. Doubled. Senator Tuberville reminded everyone that 0 Republicans voted for this disaster. The Democrats own it completely. But here's where it gets criminal. John Thune and the GAO investigation found that 90% of fake accounts were approved. Representative Van Drew confirmed that every single fraudulent application got through. Speaker Johnson dropping the bombshell. $94 million to dead people. 23 of 24 fraudulent applications approved. 18 of those are still receiving benefits right now. Tens of thousands of duplicate Social Security numbers flooding the system. Senator John Kennedy explained why Democrats won't fix it, because they want it broken. They want it as an election issue. You see, they don't want solutions. They want dependency. And we do have some breaking news for every family that is watching tonight. The same government that just got caught sending $94 million to dead people, they want you to trust them with your food supply. That's not a plan. That is certainly a gamble. This Christmas, take control with an incredible deal from My Patriot Supply. It's the Buy One, Gift Two Christmas special. All month long. When you buy one emergency food kit, you get 2 absolutely free. Grab a 4-week supply for yourself, and they include 2 one-week kits for free. Perfect for gifts. These days, it just makes sense to have emergency food stored away. This offer is only available for this Christmas season. Head to preparewithgary.com right now. Don't wait. Prepare at preparewithgary.com. Now, here's what makes this even more outrageous. Dennis Michael Lynch spoke for millions of Americans when he said he's tired of reports. He wants to rest. We all do. Senator Rand Paul laid out the solution: repeal Obamacare. Allow cross-state insurance competition, expand health savings accounts, give people control over their own health care. And President Trump made it clear the system was designed to benefit insurance companies and not patients. His plan is to redirect those billions directly to the American people, but none of that happens until someone is held accountable for fraud. $94 million to dead people is not an accident. That's actual policy. And fraud without accountability isn't a bug. It's a feature. Now let's go to the press briefing room. Earlier today, the press secretary said that there is progress with respect to healthcare costs in the country.
To higher health. As for wanting a solution to lower healthcare costs, I'm glad you said it, because the president is doing just that. He has made unprecedented progress towards lowering healthcare costs in this country and drug prices. He's secured numerous most favored nation drug price deals, with many more to come. As you know, the One Big Beautiful Bill, the working family tax cut, significantly expanded access to health savings accounts for those on Obamacare. Again, a Democrat written program and approved program, which has led to higher healthcare costs in this country. So it goes back to the issue of affordability. Democrats are now pretending they want a solution to this issue, but they created the problem. The president and Republicans are currently coming up with creative solutions and ideas to lower healthcare costs for the American people, and you'll continue to hear more from them on that. As for
every promise made about Obamacare, we know it was a complete lie. Here's more. Democrats passed Obamacare from the press secretary.
I would like to remind, as for the subsidies that are set to expire, I would like to remind you and everybody at home, why this is on the brink of happening. Democrats wrote Obamacare. They passed it without a single Republican vote, and then they ballooned it with these expensive COVID subsidies that completely distorted the health insurance market. And then they doubled down, extending those subsidies and setting their own expiration date right now in 2025, which the administration is obviously well aware of, and we are working. The president is working with his healthcare policy team here at the White House, as well as Republicans on Capitol Hill, to find a solution. As for the subsidies that are set to...
Democrats own it. They own it. They passed it. 19 hours ago, Senator Ron Johnson, Obamacare's implementation triggered a massive consolidation of the entire healthcare industry. Here he is on CNN.
It affects. So as you know better than I, the issue of health insurance premiums rising, skyrocketing really, is far beyond just people that use the Obamacare premiums. It affects every American. My understanding about the main reason why that is happening is kind of like a vicious circle, that premiums go up so healthy people quit, drop out, and don't have health insurance. And that means that the people who are left are sicker and older people, and then premiums continue going up because the pool isn't there to dilute the market, and then it just keeps going and going and going. What can be done about that?
First of all, the same number of Americans that have health care through the various, Medicare, Medicaid, employer-sponsored plans, VA, remains pretty stable, okay? So what has happened with the implementation of Obamacare is we've seen a dramatic consolidation of the entire healthcare industry. The insurers, the providers, hospital associations. So we have far less competition. We don't have consumerism. We've pretty well driven out the benefits of free market competition, which guarantees three things: lowest cost, best quality, best possible level customer service. We don't have that in healthcare, and Obamacare is taking us in the wrong direction. So again, Obamacare is faulty design on the individual market, making those small percentage of Americans bear the full cost of covering people with pre-existing conditions. I held a hearing. Maine covered people with pre-existing conditions perfectly before Obamacare destroyed their high-risk pool. So there's a way to fix this. Obamacare is not the way. Obamacare made the problem far worse.
And that's why it's time to repeal it. Let's see, we can find, do we have this whole big hearing today? Big hearing today. Here's Senator Rand Paul.
Taxpayers billions of dollars, and it costs every individual thousands of dollars a year in increased premiums. Obamacare hasn't worked. President Obama said it's going to bring down your health care premiums. It actually turned out our health care premiums will continue to rise. As conservatives, myself included, we warned in the debate over Obamacare that subsidizing insurance simply increases the demand and therefore increases the price of health insurance. Where once there existed the choice of a higher deductible plan with lower premiums, now Obamacare plans offer high deductibles and high premiums. Obamacare has largely destroyed the individual health insurance market, as government health insurance has replaced or pushed out all other private sources of insurance. My health care plan, called the Health Marketplace and Savings Accounts for All, which I have introduced recently, does two things and costs the taxpayers nothing. First, my plan legalizes the ability for any group to purchase insurance collectively and operate across state lines. My plan would make it legal for Costco or Sam's Club or Amazon to bargain for their millions of members as a single entity, therefore driving prices down. These collectives would be bigger than any corporation in America, and they would have the size and leverage to drive down healthcare premiums.
Wow.
In fact, once these co-ops are legalized, the individual market likely melts away and everybody in America would gain the benefits that normally accrue to the group market. If you joined Costco, you'd be one of 44 million members, and when they negotiate for 44 million members, there'd be a group insurance plan, and inevitably, without question, this large group would be big enough to stare big insurance in the eye and reduce your rates.
Holy cow.
My plan is the only plan being offered that would drive prices down. All other plans, such as the Democrat plan to continue add-on subsidies to the original Obamacare subsidies, will just continue to drive up health insurance premiums. They're chasing their tail. All Republican variations of these plans only vary in the cost to the taxpayer. Some in the GOP want to simply give the fully expanded Obamacare subsidies not to the insurance company, but to the HSAs. Well, in reality, that may well be a distinction without a difference. It will cost the taxpayers the same amount and simply serve as a pit stop. The money will stop in your HSA, but inevitably flow to the insurance companies.
Wow. Dude, Rand Paul has got the plan. He's got the plan, baby. Wow. Let's check in with Congressman Brandon Gill in the committee hearing today.
Says Obamacare was sold to the American people as a program that would drive down premiums. I think the number that was thrown out by President Obama at the time was $2,500. Has that promise come to fruition?
No, it has not, Congressman. And premiums on individual health insurance policies on the marketplaces and the exchanges more than doubled in the law's first 4 years, and that's primarily because of the regulatory mandates that the law imposed. And premiums have continued to increase substantially, and they continue to increase substantially more so on the exchanges than for employer-sponsored coverage.
So you would say that Obamacare didn't slow the growth of premiums in any meaningful way?
I think, if anything, quite the contrary. I mean, Senator Welch, I believe, last month admitted on the Senate floor that the law failed to reduce costs. But more than that, I think it's accelerated the cost growth because of the consolidation that has come about in terms of hospital mergers, insurers buying PBMs, et cetera, et cetera.
Obamacare was...
Let's keep going. We got some more from the committee hearing. This is Tommy Tuberville. Democrats have been complete hypocrites on health care. 0 Republicans voted for Obamacare. Premiums have doubled. Democrats own this disaster.
Absolutely destroyed our health care system. It is completely unaffordable. As a result, American families are now paying the enormous price for Barack Obama and woke Democrats' Obamacare system. Sure, the idea of Obamacare sounded great. Who doesn't love the idea of free health care? But those of us who live in reality or understand basic economics knew this was never, ever going to work, which is why not a single Republican voted for it in the Senate or the House when it was voted on. You see, Obamacare was always destined to fail. You can't pump billions of dollars into health care and not expect rampant fraud to take place. It's not possible. Nevertheless, woke Democrats rammed it through Congress, and it was signed into law by President Barack Obama on March the 23rd, 2010. It was the biggest overhaul of our health care system since Medicare and Medicaid in 1965. On paper, it sounded great. Expand access, protect people with pre-existing conditions, and make insurance cheaper for families without employer plans. But to no one's surprise, what started as a bold Democratic dream of affordable coverage for all, it turned into a bloated mess. In fact, the only winners of Obamacare are the big insurance companies who are getting filthy rich on the taxpayers' money. Meanwhile, Americans are spending thousands of dollars on premiums for coverage that often doesn't cover their needs. And Americans can thank 9 of my current Democrat colleagues who voted yes on that final passage, December 2009. Senator Murray, Cantwell, Wyden, Merkley, Schumer, Gillibrand, Coons, Durbin, Sanders, Tammy Baldwin, who was in the House at the time. These Democrats jammed this through with not a single Republican vote, ignoring real concerns about how the system would limit competition, leading to lower standards of care, or how it would line the pockets of big insurance companies while forcing hardworking Americans to pay high premiums, or how it would decrease transparency, leading Americans who often leave the doctor's office not having a clue how much money they owe when they leave, or how rural hospitals would be forced to close their doors and doctors and nurses would be leaving the medical field because they couldn't make a living. But that didn't care about any of this. They didn't care about any of it because they always knew we would end up today in the position we are. 15 years later, they knew costs would become unaffordable for Americans. They knew that. But they were just fine with that because their end goal is to have socialized medicine paid for by American taxpayers, which, by the way, has not worked anywhere in the world. They have terrible health care when they do that. Obamacare was just the first step towards free health care for all. The first step. To start, Obamacare created state-federal marketplaces where individuals could shop for coverage. These marketplaces were intended to be online for health plans. By the way, if you remember this, they spent about $10 billion and couldn't get the health care website going, but we wasted all this money. When they launched this, it just crashed. People couldn't use it for weeks, months. It cost us hundreds of millions of dollars daily. That was a foreshadowing of the disaster to come if you just think about it. On the marketplace, health plans are sorted in different levels: bronze, silver, gold, and platinum. Each level shows how costs are split, with bronze being the most basic and platinum.
And they should have added a poop emoji to select as well. Here we have Senate Leader John Thune reveals the Government Accountability Office did an audit revealing Obamacare subsidies granted without documentation.
And so I might just show you, this is what the GAO found, the Government Accountability Office, Mr. President, and this just came out literally just this last week, that Obamacare subsidies granted without documentation to 90% of fake accounts. So in other words, what the Government Accountability Office did is they ran an audit of the exchanges in which these insurance policies change hands and found that 90% of these fake accounts, Mr. President, were granted subsidies without documentation. And so we have spiraling healthcare costs, a program incredibly vulnerable, as is this is evidence, vulnerable to fraud and abuse. And again, Democrats are proposing that we do absolutely nothing. And so I might just show you, this is
absolutely nothing. They just want the corruption to continue. Who's getting that money? Let's see if we can find some more here. Obamacare fraud. Here's Representative Van Drew. No, let's go to Senator. House Speaker Johnson.
Well, Accountability Office, which I haven't seen too much written about yet. You should look into that. It is an eye-opener as well. It makes clear why it would be a dereliction of duty to just extend subsidies without massive reforms to them. Okay, over the last 2 years, this is investigators at the Government Accountability Office. Okay, they submitted 24 fraudulent applications for the ACA subsidies, the Unaffordable Care Act subsidies, Obamacare. Okay, of the 24 fraudulent applications that they created intentionally to just see what would happen, 23 of them were approved. These applications were completely fraudulent. The investigators did not submit any Social Security numbers, citizenship documentation, or reported income documents. And 23 of the 24 applications were still approved. 18 of those, by the way, are still receiving coverages they were as of September of this year. That means the Obamacare exchange and insurers didn't verify any of the information they're supposed to under the law, and they proceeded to pay tens of thousands of dollars to insurance companies for people who do not exist. Okay? The GAO report also found that 29,000 Social Security numbers in 2023 and 68,000 in 2024 were used to receive more than 1 year's worth of insurance coverage. In other words, multiple people were utilizing the same Social Security numbers to openly defraud the American taxpayers. The GAO also found that more than $94 million was sent to insurers on behalf of dead people. Okay? This is the system that Democrats in Congress want to extend without reform. It's unbelievable. Accountability Office, which I haven't seen too much written about yet. You should look into that.
No one's talking about it. The mainstream media won't touch it because they're all in on it. I mean, you guys know that. Oh, let's go to Senator Kennedy.
As part of reconciliation, we need to do a health care bill as part of reconciliation. We need to invite the Democrats to join with us, and a few might, but most of them won't because they don't want to solve the problem. They want to maintain it as an issue in the elections. That doesn't mean we ought to do nothing.
Can you do that, though,
we need to
before the
reform.
premiums go up? Can you get that done before people start having letters in the mail that say, I'm going to be paying, double what I was paying before, and looking around and saying, whose fault is this?
No, and that's the Democrats' fault. They shut down government.
Yeah.
We should have been doing this, talking about this back in October. But frankly, back in October, we should have started a reconciliation bill, and the Republicans should have done this all on their own without Democratic support if the Democrats don't want to join us. We know how to fix the Affordable Care Act, Obamacare. We know how to stop the fraud. We know how to do PBM reform. We know how to do site neutrality. We know how to design a healthcare delivery system that looks like somebody designed it on purpose. But I'm sorry, I hope I'm wrong, but I doubt it. The Democrats aren't going to help us. No one's coming to save us but ourselves. We need to do a health.
And I think we got a clip here from the President of the United States. Here he is. This is just 23 hours ago.
Affordable because it's well, the Unaffordable Care Act, which is Obamacare. They call it now the unaffordable because it's unaffordable. It used to be called the affordable, but it was never affordable. It was always bad. It was basically designed for the benefit of insurance companies. And what we're doing is we want all of the billions and billions of dollars that went to insurance companies to go directly to the people, and they can buy their own health care. And people love it. I don't know if the Democrats are going to approve it because they want the insurance companies to make money. It was a scam. Obamacare was a scam. But we're going to see. I mean, the Republicans, I can tell you, want the money to go to the people. And we're winning that battle. The Democrats are having a hard time with it because they're in the pocket of the insurance companies. Well, the Unaffordable Care Act, which is Obamacare.
This is the conversation that needed to be had for a very, very long time. And I'm glad someone's finally addressing this. It really came to a head during the shutdown, if you recall. They kept talking about the subsidies going up. We need to address this. Well, guess what? We're going to address it now. And now all the corruption's coming out. Oh, yeah. So let's be clear about what the evidence shows. The GAO tested the system with obviously fake applications, and 90% were approved. $94 million going to dead people. Duplicate socials everywhere. And the people who designed the system are still walking free. It's not healthcare, it's a heist. Until someone goes to prison, nothing changes. And Senator Kennedy's right. Democrats want it broken. They profit from chaos, but the American people are waking up and they're demanding more than reports, they're demanding justice. So we've been tracking this Obamacare fraud story as new evidence emerges, and tonight's revelations are the most damning yet. The GAO created fake identities, 90% approved. Speaker Johnson revealing 94 million sent to dead people. 23 out of 24 fraudulent applications sailed right through. 18 still receiving benefits today, and tens of thousands of duplicate socials are in the system. And Ron Johnson exposed the consolidation scheme. Kennedy explained why Democrats refused to fix it. And Dennis Michael Lynch said what we're thinking. Enough reports, we want arrests. This isn't a healthcare program anymore. It's an industrial-scale fraud operation baked into the system by design. And fraud without accountability isn't incompetence, it's policy. So we're going to continue following this story as evidence mounts. I'm asking my question for you. I have to ask you, should there be criminal prosecutions for Obamacare fraud? Yes or no? Drop your answer in the comments. And while you're there, visit our merch shop. It's linked in the description.